Welcome everyone to WHRTN's final CCI webinar for the year. My name is Leslie Arnott and I am the Consumer Partnerships Lead at the Women's Health Research Translation and Impact Network, affectionately known as WHRTN, more easily said as WHRTN. So if you hear us referring to WHRTN throughout this webinar, that's who we are. I would first like to acknowledge the Aboriginal and Torres Strait Islander peoples as the custodians of the unceded lands upon which we meet today. For me, it's the Wurundjeri Wurrung people of the Kulin Nation. And I pay my respects to their elders past, present, and to those who will guide us in the future. And we especially take this time to recognize and honor Indigenous women who are here and those who have come before us. And we look to their collective wisdom in guiding our work. And we seek continued partnership as we work together to improve health outcomes for all women living in this land. And so I give a shout out to those Aboriginal and Torres Strait Islander peoples who are joining us today. Welcome. So here are our wonderful speakers who will be joining us today. Debbie Passy from the University of Melbourne, Wendy Anders, who is the CEO of the National Aboriginal and Torres Strait Islander Women's Alliance, known as NATSAWA, and Professor Jeanette Purrs from Western Sydney University, who also sits on WHRTN's steering committee and our CCI subcommittee. We want this session to be as interactive as we possibly can, so please feel free to put questions in the Q&A box, and we will answer them intermittently all the way through this webinar. So don't be shy in asking questions. We're happy to stop and answer those questions for you. And firstly, before we hear from our speakers, I'd like to get you thinking a little bit about what it means to measure CCI success. So should we ask ourselves, who are we measuring this for? And if we ask that, are we more likely to learn why and how we're measuring it and work out what we hope to get out of measuring it? So all of these stakeholders on the slide here are relevant when we ask these questions. How do we measure CCI success? And I'm sure some of you would look at this question, look at the images on the slide and go to the CFR, the Consolidated Framework for Implementation Research. So at WHRTN, our main focus is women from priority populations. And recently we've been conducting a project that looks at how various organizations engage with women from priority populations, and just as importantly, how those women engage with the organizations. So I'm going to be sharing more of those outcomes of that project with you in the new year on our first webinar for 2026. But as a sneak preview, I kind of wanted to share with you in particular what we discovered when we asked this question: what does successful partnerships with priority populations look like to you? But before that, I just want you to consider many of the guiding principles for working with consumers in research and how they invariably include building and maintaining relationships as a major tenet to successful and meaningful engagement when co-producing research projects with consumers in our communities. And indeed, WHRTN has looked to the NIHR, which is the National Institute for Healthcare Research. Their principles have guided us in many of our projects that we've conducted over these past several years. So they are sharing of power, including all perspectives, respecting and valuing the knowledge of others, reciprocity, and of course, there we go, building and maintaining relationships. And I just want to draw your attention first to that, the first one of sharing power. We've actually changed that a little bit. We've heard from our Indigenous colleagues that the word power is a colonial term. And it's also associated with power and control around women in the violence against women space. So we've changed it and we've actually made it sharing of leadership. So that's the term that we use now. So it still gives the same connotation, but it takes the word power out of it. So perhaps one way of measuring CCI success is to go to a set of principles similar to these and ask consumers and maybe even ask researchers these questions. You know, did we share leadership? Did we include all of your perspectives and skills? Did we respect and value the knowledge of others? Was there a giving and a receiving of wisdom and expertise? And did we build relationships in the process of working together? So going back to what I mentioned previously, as part of our priority populations project, we ask our interviewees, what does successful partnerships look like to you? And the overwhelming response was about connecting with communities and building and maintaining relationships. These were key to CCI success. We learned from some of the organizations and the women they serve that it's not necessarily about strategy, having a strategy in place. It's more about building and maintaining relationships as simply a way of working. It's like BAU, business as usual. So I just want to leave you with that thought. And we'll probably hear more about this, probably in Wendy's presentation as well, one of our speakers here today. But for now, I'd like you to switch your gears and think about how tools and/or frameworks can also be useful in measuring CCI success. And it's depending on who's doing the measuring and what we're measuring for. I want you to consider that the meaning of success can maybe be fluid based on different researchers, different consumers, different reasons for measuring, different women from different priority populations we're working with, and what you want to measure. So with that in mind, I'm going to stop sharing my screen now. Let's see if we can get that off. There we go. And I'm going to introduce you to Debbie Passy. And Debbie, you can start getting your slides up if you like. And Debbie is a research fellow with the University of Melbourne Centre for Digital Transformation of Health. And she works in the Validitron Sim Lab. And so Debbie's research focuses on getting evidence-based practices to the people and groups who need it, which is a great reason to do research, Debbie, I have to say. So welcome to the stage. Take it away.
Thank you. Goodness. Good afternoon, and thank you for being here and spending your Thursday afternoon with us. My name is Debbie. I'm a research fellow, as Leslie has said. And today I'm going to talk about measuring CCI success in research. So I do want to acknowledge I'm coming at this from a very academic perspective, but that's what I'm here to do, is bring that. Let me get next. I'd like to acknowledge the traditional owners of the unceded land on which we work, learn, and live, the Wurundjeri, Wurrung, and Boonwurrung people. I'd like to pay my respects to elders past, present, and future, and acknowledge the importance and ongoing contribution of Indigenous knowledge in the Academy. So CCI is recognized as essential to high quality, equitable, and impactful research. And I think a common question is, how do you measure success? And this is where our poll comes in. So first question, have you measured CCI success in your current or past projects? And then the second one is, how has your perception of measuring changed? But that one we're not going to answer yet. But that first one, how have you measured it in your projects? And we'll just take a minute to do that.
A good reason for this webinar.
I know, gosh. All right. Glad to be here.
Yeah.
The other question I was going to ask, and I think it's probably not relevant given how many people have said no, was what methods you have used. But given that most people have said no, I'm sure, I think we can probably skip that one for now. Okay, so let me go on. Sorry. So I'm going to present a couple ways. So we can measure success using quantitative measures such as surveys or checklists. So we can count how many people were involved, how often they contributed, maybe how many meetings they attended. And these numbers can be useful, and oftentimes funders want you to report this, but it only gives a partial picture. It doesn't tell us about the quality, depth, or authenticity of that involvement. So these are a couple examples. There's a systematic review of these. This one up front, the survey items, is from the Community Engagement and Research Index. But there's also other frameworks that go a little bit beyond just a quantitative measure. So the Involved framework from the UK uses the principles based on the NIHR principles for patient and public involvement. And so on the left are these principles, and then on the other side is some measurable metrics that can be addressed at the individual team and organizational level. And this is one way that researchers can report CCI success. And so this kind of highlights recognizing different levels and types of participation. The GRIP reporting checklist, this is a widely used tool. It kind of is very simple. There's 5 areas, and it's one way to guide researchers in documenting the purpose, methods, context, and impact of CCI. So it does include one section on self-reflection, so thinking critically about what went well and what didn't with CCI. And so a reporting checklist like this can help researchers measure the impact, but also be a little bit transparent about what went well so that others can learn from that experience. This next framework, this looks really intimidating, but I just wanted to pull out some of the domains. So the critical outcomes of research engagement framework has 11 domains to assess impact. It's called the core framework, and it emphasizes identifying the outcomes of engagement. So what actually changed because consumers and communities were involved. And so the idea behind this framework is to reinforce CCI by asking at each stage of the research process, how did the research change? Did the research questions shift? Did the methods adapt? Did the outputs improve? And I think these can be really good indicators of meaningful CCI. And then I wanted to also just highlight, and I think Leslie was kind of getting at this with the relationships, is not everything that matters can be easily documented. Sometimes some of the most significant impacts of CCI in research are invisible to those traditional evaluations and reporting methods. And these can be things like building trust between researchers and communities, enriched relationships, growth and confidence, and changes in worldview for both the researchers and the consumers. So these are some of the, I think, unseen transformations that often underpin long-term success. And I don't know, these are harder to capture with current evaluation approaches. So I think there definitely needs to be evaluation approaches that allow space for them. And I think that's probably where qualitative research would help. I think, Leslie, you already highlighted this. I just wanted to highlight the NIHR Co-Design Handbook for Researchers is a really useful resource for researchers that are looking to integrate CCI into their research projects. And I think I really like this handbook because it's not scary and huge. It's very simple and straightforward, and it gives you a lot of good ideas for where to steer your research. And I wanted to highlight, so at the Center for Digital Transformation of Health, which is where I work, we've co-developed a CCI principle with consumers and researchers. And this work took over a year with workshops with consumers and then interviews with researchers. And it was a very intentional process. And you might notice our principles are kind of similar to those NIHR, and our principles are derived from those principles. And they're there to help guide our work and help us evaluate our progress towards CCI success. And I really think they reflect our commitment to this, to doing this in research, especially in digital health, where digital health often doesn't have the consumer involvement. And so I really think it's important, especially in digital health, that we have these principles embedded. Okay, so I'm going to do a quick example and then I'll hand it off to the next speakers. But this is one example of a project where um, it was very successful with CCI for reasons that we'll get into. So this project focused on co-designing a perioperative survey with lived experience consumers. The clinical problem was that healthcare providers need certain patient information to reduce complications and deliver more patient-centered care with surgery. And so co-design offered a way to make the survey both clinically meaningful and patient-centered. Our project team, I have to say our project team were all women, which is awesome. I just realized that when I when you started the webinar, I was like, oh, we were all women on this team. We had a health economist. I was the implementation scientist on this project. We had a health equity researcher, and then we had a consumer engagement specialist, which is a paid role at our center. So the consumer engagement specialist joins projects as an equal part of the research team, and their role is the consumer. And then our client was a health service that needed to develop a perioperative survey. And the survey was really important to them because they had this patient information prior to surgery that is really helpful for the team so that they can provide better care, reduce complications. So there were 3 parts to the development. There was the initial survey development. So this part was from the health service. They said, these are all the questions that surgeons and the healthcare team feel like they need this to avoid complications and improve outcomes. So that was the clinician perspective. They gave those questions to our team, and I reviewed all the questions, looking at clarity, readability, making sure the questions adhered to survey best practices. And then we had a consumer review where lived experience consumers provided input on the survey. And this third part of it was really crucial for ensuring the survey reflected, the patient needs and making sure it's focused on them. So we ran 2 focus groups with 10 consumers, intentionally achieving maximum diversity and intersectionality of perspectives. So our participants represented a range of cultural backgrounds, genders, ages, rurality, identities. We had called participants LGBTQI, individuals, older adults, rural residents, Indigenous participants, and people with disabilities. So this diversity really enriched the feedback that we got and ensured the survey would be relevant across, a wide patient population. So the consumers' contributions led to significant improvements for the survey. The survey became more accessible and easier to understand. The implementation approach was strengthened. So the consumers really helped us identify where support structures would be needed, such as where interpreters or social workers could, step in. The design improved, like the layout, the flow, and the usability. And the consumers even brought up data security and privacy considerations, and those became more clear and actionable because of their feedback. So these were really concrete, measurable impacts driven by consumer involvement. But the project also had meaningful impacts on the research team. I think it really reinforced with us the value of partnering with communities and consumers, not as an obligation, but as an enriching and essential part of producing better research. We heard from consumers that the experience was positive. Some spoke about the positive influence the process had on them, and just, that confidence of being treated as genuine partners in this. And it left a lasting impression on everyone involved. One of the researchers after the project emailed our center director just talking about how much this focus group and this work impacted them. And this was a health equity researcher who had been doing this type of work for a really long time. So it definitely changed my worldview. And it's one of those projects I often reflect on when I am talking to people about CCI. I'm like, yeah, definitely This is one of those like life-changing experiences as a researcher. So I'm just going to summarize and then I'll pass it back. But to summarize, you can measure CCI success. You can look at the impact on, did the research questions change, the methods, how did implementation change? You can look at the improvements in outcomes and outputs, are these more relevant, more equitable? But you can also look at those shifts in researchers' perceptions and views. How does it impact the research team as they move forward? And also consumers' own experiences. And I think CCI success is about that impact, but it's the impact on the research and the people involved and the broader communities we serve. So yeah, I think this was a really great experience. And so I again want to plug CCI is so important in research. And that I will hand back to Leslie. Oh, let me stop sharing.
Thanks so much, Debbie. That was fantastic. I just wanted to ask you a question about that case study that you gave, which was a fantastic example, of success in CCI. And I also love the fact that you highlighted previous to that, that there's some things that you might consider that are unmeasurable, and yet they, have enormous impact. And how do we measure that impact, right?
Mm-hmm, mm-hmm.
So can we just talk a little bit about the impact on the researchers? And our theme here is, about how do you measure CCI success? How do you measure consumer and community involvement that it was a success in a project? So thinking of those researchers' perceptions, let's talk a little bit about the perceptions before the project. How's that? So
Yeah.
if you can think of not only yourself, but the individuals, the researchers who you mentioned earlier, can you remember what their perception was prior to the project, prior to the focus groups?
Yeah, I feel like in the team meeting we had before the focus groups, it was like, okay, yeah, we're gonna do focus groups with consumers. And it was kind of like, all of us are people who have worked with consumers and have done this work in the past. And I think for us, it was kind of like, well, this is just business as usual. We're gonna get the consumers will provide some input and then we'll give the survey and give that feedback back to the health service. Like it was kind of like, let's just do the business as usual.
Right.
This is our bread and butter. We met
And
after the focus groups.
okay, just hang on. Let me
Oh,
just hold
sorry.
you there. No, that's good. That's good. That's exactly what I wanted. Okay, so when you said, did you think that you knew kind of what the consumers were going to say?
I think for me personally, I kind of thought like, oh, they'll probably have some feedback on some of these things. I I wasn't exactly sure what to expect, but it was like, okay, we'll get feedback, and whatever the feedback is, we'll incorporate it and give it to the service. But I didn't think too deeply about that part. I just thought, oh yeah, we'll just see. And yeah,
Okay.
I had a very surface level kind of, yeah, we'll just see,
Yep.
this is what we're doing. It's part of the project.
Okay.
I will admit,
So,
I had no idea. Like I don't know. I didn't think about it that deeply.
okay. And so afterwards, so you were just about to say what you thought. So what were the perceptions? Can you remember the comments that were made or the perceptions that were voiced?
I will try to capture. So in the meeting after the focus groups, like all of us were just like, oh my God, that was incredible. That was such a great, like the focus groups were so good. Like people were so engaged. I was really surprised. And I mean, I was very happy, but I was very surprised at the breadth and depth of the responses from consumers. Um, they brought up like data sovereignty. They brought up the having interpreters, having social workers. They brought up so many things that um, I don't think I would have thought of as a researcher. and I think that's where that lived experience comes in. Like for me as like an able-bodied person who speaks English and goes to the health service, it's like I wasn't thinking about some of these things that they brought up. And again, it was like, okay, this totally has reinforced my worldview of why we do this work and why, like, it shouldn't just be checking a box off. Like, it needs to be really thoughtful. And I mean, we were thoughtful in our process, but I think we were really blown away at what actually happened with it. And it was one of those experiences that, like I said, I'm like, I'm never going to forget it. And as I move through and go through other projects, it's something I think about constantly.
Wow.
Like when people think of when I'm in a meeting with someone and they're like, oh yeah, then we'll get consumers involvement. I'm like, wait, why do you want to do that? Who do you want to, like it makes me really like think about it more and more deeply, and really try to approach it as not just a way of like, we're going to check this box off and move on, or it's just part of it. It's thinking more through, I don't know, and I'm going to humble myself and listen to what the people who do know what they're going to tell me. And I think,
Mm.
yeah, I think in academia it can be really easy to be like, oh, I'm the expert in this. I've read all these papers and I've done all this. I think people think that, but it's like you're not the expert at people's lived experience. That's
Yeah.
theirs and that's for them. And that's, yeah, it was definitely a really life-changing as a researcher. So, and
Yeah.
it's also it, and it's a small project too. Like this project was like a 6-month project. This wasn't a huge
Okay.
MRFF project as well. And so I do want to say, like, regardless of the size of project, I think that CCI
Mm.
is so important.
So
So
that's amazing. That's an amazing observation too, Debbie, because the project was small, but the impact was massive
it was
to you.
huge.
Okay,
Yeah.
that's great. That's terrific. So you mentioned earlier on in your speech about, or your presentation about numbers. Like we can actually, some people like to measure numbers. In other words, bums on seats, like that's successful and that type of thing. What you're talking about here is people's behavior and or perception is changed for life. So that is another way of measuring how successful CCI can be. So that's a
Hmm.
terrific example of we've gone from numbers to actually going, hey, my mind and my way of working has been changed immediately. So you can measure that. That's another way to measure success,
Hmm.
the effect from CCI. So thank you so much. That was fantastic.
Thank
Um,
you.
I'm just going to check our Q&A. Um, there's a question in the Q&A. Were there any maternity care or parents involved as consumers? Would that be useful? Elena, can you just um, expand on that in the Q&A so that we understand the context of your question? And I'll get back to you in a second. I just wanted to know also if Jeanette, you had I'll just bring Jeanette Pers into our discussion here, and wondered, Jeanette, if you had any comments as to Debbie's revelation in that project.
No, no, I thought it was fabulous, Debbie, and it's great to see the attention that's being given, not just to engaging consumers, but actually capturing the value of that. And it's a shame that we still need to, in a sense, account for the value. But I think apart from that cynical reason of, satisfying funders and other bodies like that, I think it's just very good practice to be doing that anyway, because it's the only way as researchers that you're able to actually know that you are making a difference, that the work that you are doing is actually building, it's making that contribution. So, and for many, without having the sort of the framework that you spoke about for measuring and capturing the success, I think many researchers feel that they're doing it, but don't actually, and so anecdotally might talk to their colleagues about it, but they don't actually have a way of demonstrating that, not only to others, but to themselves. And I think that's really important because it's part of the validation process of engaging with and doing CCI properly. So, yeah, I found that a really interesting presentation, and you took us through it really nicely and clearly. And I also liked the resources that you were pointing us towards, because it's one of these things where we're all still learning in this process, and so having some really clear and useful guides is really helpful. So thanks for that. I've taken down notes myself. So
That's great. That's fantastic. Thanks so much, Jeanette. I'm just going to check the queue. And oh, here we go. I was just going to say, Elena, if you can get back to us in the Q&A box about your question, that would be great. So don't be shy in letting us know the context in which you're asking the question. I've got a question here from Sarah. How do the panel manage the instances when the researcher has dual roles of researcher and lived experience? And as an example, a number of eating disorder researchers have a lived experience of an eating disorder. That's a really terrific question, Sarah. I'd actually like to address that question, and I'll get the others to address it in a second. We have this. I have a little bit of a rule of thumb when I'm recruiting consumers into roles. And I have this rule where I say it's much better if you don't recruit clinicians who want to sit in the consumer space. And part of that reason is because we already have clinicians there. So we already have that taken care of. And sometimes clinicians bring the institutional perspective to the space. And so therefore we say, well, we don't want that. We actually want an independent, fresh, new or different opinion to the space. And I used to say, you shouldn't have a researcher or a clinician. And now I have actually changed my mind on that, because there are lots of people who have the lived experience way before they become a researcher. So they are steeped in support groups and linking in with networks that have helped them with that health condition. And so therefore, their lived experience is quite rich. It's quite amazing. So I have actually modified that little caveat of mine just to say it's probably better not to have clinicians as consumers on your committees and your research teams. But so let's go back to, I just wondered if that might be helpful too, Sarah. So just go back to that question. How do you manage the instances when the researcher has dual roles of researcher and lived experience? So I'll hand it over to Deb. Do you want to have a go at that?
I'll just say I've heard competing responses about this, because I've heard people say, oh, that's a conflict of interest. No, you can't. Which I kind of am like, I don't know if that's for you to judge that. Like sometimes people who have the lived experience have a better understanding of what research questions to ask and methods and all that. So I don't know. I have come around to, I think it's okay to be a researcher and have a lived experience consumer role. And I think as an academy, we should not tell people they can't have both roles. I don't know. That's just my personal opinion. Like
Yeah.
I would like more people with lived experience to get involved in research.
Wendy, did you? Yeah, Wendy. Sure.
Look,
Come on in.
I think we look at lived experience as really important, because if you've lived it yourself and you're the researcher or you're the clinician or whatever, that gives you a much more in-depth understanding of what the person is talking about. So I think it's really, something good to have that person who's got that lived experience on the team.
Great. Thank you.
Yeah.
Thank you. Jeanette.
Yeah, I love what the fellow panelists are saying, and I'm glad, Leslie, you've gone on that journey of discovery because I know we have had discussions around the
Yeah.
role of the consumer and the researcher, and I've always been a strong advocate for you take the best people into a team, and sometimes one person can carry multiple sort of or have multiple things. In fact, it's more complex than just being a consumer and a researcher. You also have an ethnic background. You also have sexual history and orientation. You're a parent or you're a child. Like it's much more complex than that. And I liked, Debbie, how in your slides, you try to capture that that intersectionality as best you can. But even when we do that, we still try to put people in one box. We have to get much better at addressing the complexity. But I distract myself, Sarah. I just wanted, I thank you for the question, but I like you've got the word in there, manage. How do we manage those dual roles? I don't think we need to manage them. Okay, we need to acknowledge it, but I don't think we can manage it because that is life and it's part of the complexity of life. But should we acknowledge it? Yeah. And should we note what influence it might be having upon the outcomes or the direction? Yeah, we have to be aware of that, but I don't think we should try to manage it.
Jeanette, can I ask you something more further to that? One of the things that is helpful for research teams to begin with, and of course, I'm a huge one on principles, and I think that, we should all start with an agreed set of principles right from the beginning. And the other thing too is perhaps a description of roles and responsibilities and what those people will bring to the table. So if there is an articulation of roles and responsibilities, and indeed you could have articulation around the fact that you are both. You have the lived experience of the condition, disease, whatever it is, as well as you are researching that because you're passionate about it. And if that is articulated, then any type of, Debbie, you mentioned conflict of interest. Sometimes conflict of interests are fine as long as we manage them well, which means we acknowledge them, we articulate them, everybody's aware of them, and we manage from there. I was wondering, Jeanette, what you would think about what you think of that in terms of articulating roles and responsibilities that may help to manage that as well.
I think it's critically important, and I liked, the way you're talking about it in terms of articulating those responsibilities and roles. I think it's also really important in terms of the capacity building that we need to be involved in when we're engaging in research with people who are not researchers. And that is both consumers, it can be our industry partners, our service partners, it can be a whole range of people who are not necessarily consumers. But by articulating those roles and responsibilities, you're actually engaging in part of the learning process and part of the training process about what research is, what the expectations are, and people can identify, well, I can't do that, or I don't have experience in that. So then it helps you identify areas where you may need to put in some development and additional support. So I think there's lots of benefits to doing that sort of thing very early on. And likewise, researchers have to identify their limitations as well. But I think it's a great way of actually serving multiple and achieving multiple gains.
Mm-hmm. I'm just going to the Q&A box once again. Eleanor, thank you for so much for coming back. So that she said there's a long tradition of CCI and maternity care space, both research and clinical practice that could inform CCI frameworks. In the case of research with children, the involvement of parents is crucial. I was wondering if these two areas were covered or if these populations were considered. And Elena, I think you're referring to Debbie's presentation. Were those populations covered or included or captured in the focus group of the people that was that were of the people that were in the focus group? Deb.
So children were not involved, but this was because the perioperative, mostly because the survey was going to be administered to not children. The surgery was not for children, so the survey was not targeted towards children. We definitely had people in there that were parents. So, I mean, there were parents in there, but
Yeah.
I will say so Murdoch Children's Research Institute has a really great toolkit for involving children in research called Voice of the Child. I'll put a link in there, but I think that's a really great resource if you're going to do CCI in a space that does involve children or parents and children. But in this particular project, that wasn't
It wasn't specific to that.
it wasn't specific to children,
Right.
or maternity care. So
Yeah. And Daniel Hitch asked, do you think the dual lived experience clinician role reflects intersectionality?
oh gosh,
Jeanette,
yeah.
I'll just fire that one over to Wendy, actually. Wendy, do you
Yeah.
want to take that one?
Yeah, absolutely, it does. Absolutely.
It's a gorgeous question. Thank you,
Good
Danielle.
question, and it does cross across all intersectionalities, particularly with women
Doesn't
who
it?
have a lot of dual intersections going on. So
Yeah.
yeah, absolutely.
That's fantastic. Okay, I'm going to move us right along. We've had a terrific discussion so far, but now Wendy has been making comment, but I will formally introduce Wendy to the stage, and I'm just going to bring up the slides. Is it this one here? No, it's not. Is that one? There we go. We're just putting that one on. And so I'm going to introduce Wendy Andrews, who is the CEO of NATSAWA, as you know. She is a proud Arrernte woman from Alice Springs. And Wendy, can you pronounce the Indigenous word for Alice Springs, which you sent to me? Can you remember?
That partway.
Thank you. With a background, and Wendy has a background in public health, community development, and education. So thanks so much, Wendy. Take it away.
Thank you, everyone. It's really great to be here. That was really excellent, Debbie. I really enjoyed listening to that because it's very different to what I'm going to be talking about.
That was the whole idea, Wendy.
Sorry, I've been traveling, and every time I get on a plane, I get a bit of a chest thing going. So please bear with me. So I first of all want to begin by acknowledging country, the elders who guide us, and the Aboriginal and Torres Strait Islander women whose voices we use shape in every part of the work that we do. I don't know if anyone knows much about NATSAWA, but I'll have to give a little background, I suppose, because we are funded under the Prime Minister's Council through the Office of Women to provide advice to government and stakeholders at a national level. In order to do that, we need to work with our women. We have 1,600 members currently, but we work with all women across Australia, Aboriginal and Torres Strait Islander women across Australia. So in order to do our work, which is a lot around submissions, open letters, policy papers, briefings to government, we attend a lot of Senate committees. So we have to have information provided to us from our members and our women. So we need to go about doing that. How do we go about doing that? And that's where what we do is a little bit different. The way we do it, it's really important because it's not the same as doing normal research. We don't call ourselves researchers, we call ourselves data gatherers because none of us are researchers. But the first thing we do is we look at what is happening. What do we need to know? We don't make decisions in isolation. For us, it's not a technical process. It is more a cultural responsibility to make sure that what we're doing is appropriate and that we have a community accountability. So all our research starts with what do we need to do? Where do we need to go? Who are the people we need to talk to? So we go to community. It always begins with community. We don't create the research questions in isolation. We try and look at what is emerging, what we're hearing from communities, and that gives us an idea of where we probably need to go. So we look around and we decide, okay, we're going to go and talk to this group around housing, around domestic violence, around a whole range of topics. So we look at, do we need the urban voice, the rural, the remote voice? So then we look at what communities we would target. And from that, we make contact with people who we may know in the community, or we go to organisations in the community and put it to them as partners. So when we get to looking at stakeholders, particularly we put the question out, and we need to be invited in. We don't just go into a community, we have to be invited in. We sit with the elders, the knowledge holders, with local women's groups, all sorts of organisations, and we follow the whole cultural protocols. And we got guided by the leadership in those communities on what we can and can't do. And we always believe it's a privilege, not a right, to be invited into community. You can change a slide if you like. Thank you. I've got poor Leslie working for me today.
That's
Changing
okay.
my slides because I'm hopeless at it.
Oh, that's all right. I'm hopeless at it too, Wendy. For some reason, it won't change. I don't know why it won't go.
That's okay.
Oh, there we go. Did that work?
That's great.
Okay.
So we follow Indigenous methodologies as much as we can. Of course, we have to do the same as everyone else. We have to have confidentiality, tick all those usual boxes, make sure women are really clearly understanding what we're doing, how we're doing it. So our research is really grounded in the Indigenous worldview, ways of knowing. We don't rely on survey tools or data extraction methods or anything like that. We actually do what we consider culturally meaningful for our women, and that is listening to them, hearing their stories, making sure that, you know, they're able to tell us what they want to tell us. And we know from history that our members and our women don't like doing surveys, so they want to meet with us face to face. So if we do a survey on something, we may get 20 responses, but if we go into 2 or 3 communities, we may get 100 responses. It just depends also on what we're actually talking about. So we do it through yarning, storytelling, deep listening, on-country knowledge, cultural mapping, strength-based approaches. We gather the information directly from the women because their lived experience is the height of our knowledge for us. And I don't know if I said change slide.
Okay.
So we always go back to the women and say, okay, the first time we came, we got this information, we've come back again. We go back time and time and time again. Always to verify that the information they give us is correct, that we're representing it correctly. And we always do this in really comfortable, safe spaces for them. So the women decide where they feel comfortable. Sometimes it's only women's spaces. Sometimes we have men included if women want it. We don't extract any information. We don't put any pressure on our women to talk. We just give them the floor and hear their story. And our women have always shown that they want to tell their story in context. They don't want to just answer yes or no. They always want to give us in context. And from that, we get so much more information than we could ever imagine. We may have gone into the community for one thing, but we come out with so much more rich information. And that's pretty much how we measure success. So we don't just tick a box. Okay, I've got the information on that I came for. We will go back to the women and say, is this correct? Is this right? is there anything else you want to add? And you'll find that that data gets bigger and bigger as you go along, and they remember things, and they bring up more and more and more. I'm going to change the slide. What are we up to? So we are fully accountable to our women. They're central to everything we do. We don't collect information and then just disappear. We often have our women reach out and talk to us about their information and how it's going to be represented. So when we're looking to measure, have we done what we meant to do? Have we got the information we needed? Sometimes it is just in the fact that we've just sat with that person 2 or 3 times, and that relationship we've built. And relationship building is a very big part of our methodology and how we work and how we measure our success. And for us, a win is not, it could just simply be the fact that the government has picked up on something that we've recommended, that we've suggested, that we've put a submission in about. It doesn't necessarily look measurable if you're actually, looking to say, oh, okay, we've got 10 people in the room. This is a measure of success. 5 people answered that quiz or whatever. That doesn't mean anything to us because we don't measure like that. Measuring the level of data we have, the information we have, the stories we've heard. We don't always do what government wants us to do. Sometimes I've been delicate here, we are funded by them and they do say we want to know about this, and sometimes we'll come back and say, well, no, that's not what the women are talking about. That's not an issue for them right now. This is major issues you need to be looking at, and this is what we think should be done. So we have a lot of success when we do push back a little bit. So success for us is a lot different to what any other organisation who is doing research would look like. It's the richness of the information, and if government picks up on something that we've put through, then we think we've really achieved what we set out to achieve. Do you want to go to my next slide, please? And I'll give you an example with a small project we did on housing. We'd heard that from a woman who had disabilities, who was raising children with disabilities, that she had some issues around her housing. She had 2 children in a wheelchair in her house, had a very, very steep driveway, and she'd been in the house for about 4 or 5 years. She'd been on the housing waiting list for 10 years. So we decided that this was something we really needed to have a look at and put some advice up to government around some change. So we did the process we normally do. We looked at different communities. We chose 3 or 4 different communities, and we approached different organisations, and a school actually who has a disability program contacted us and said they would very, very much love to be part of it. And so we did go into that community as well as a couple of others. And this is just stage 1 of our project, because it's now gotten a little bit out of hand, because we're getting requests from communities all over the place to come in and talk about these issues and have a look at their housing situations. This little small project has developed into something really huge. When we always provide reciprocity to our members. We never do anything. Their information is valuable, so we do give gift card or something like that when we do it, so we don't do anything for nothing. And so when we started talking to the women in the community about their housing, one of the biggest things I wanted to talk about was NDIS and the issues they're having with NDIS, and that was across just about all the women. And I was really surprised by that, because I didn't realise there was such a big problem with NDIS until we actually started talking to these women. And there are huge, and it was quite amazing to hear, 10 women in this particular community all say exactly the same thing about NDIS. So we're now working with NDIS to try and solve some of it. We also got some information about housing. We also got information about cost of living, a range of different issues. And we've gone back to them and asked them, can we use this in other ways in our advocacy? Can we use it for policy briefs? Can we use that information across a whole range of different things? And usually the answer is yes.
That's
So
great. That is lovely success, Wendy. I have to interrupt you there just to say that is brilliant success, or
yes,
those stories that have come to you. And it's kind of similar to what Debbie was saying in her project, where you were blown away. All of a sudden you found out about this problem with NDIS and you weren't even going in there to find that out. And Debbie was the same. She said, wow, we didn't see that coming. That was amazing. So yeah.
And that's the richness about the relationship building, because you get the women feel comfortable enough. They've met you a couple of times. They're comfortable enough to talk to you about everything. And women often will raise health issues that we're not quite prepared for, because we didn't come in thinking about that. But we always take on board anything they tell us, and we also never go into community without making sure that it's culturally safe, appropriate, and that there is support for them if they're talking about domestic violence or other health issues that they may need to talk to someone afterwards. We don't just go in and leave. We make sure that there's contacts and that they have people to talk to. So, that's how we sort of tend to do what we call data gathering.
Right.
It's very, very different to how most organisations would do it, but it's all built on the relationship with our women and who we're talking to, the elders. In some cases, we have worked with men looking at how, solutions to domestic violence and making it a man's issue. And in particular in Torres Strait Islander, we had a meeting with the local men and women and talked about the issues, and that was really, really rewarding because it was really in depth, and they talked themselves afterwards as well. So we sort of set up a little group for them to go on and do some more work on solutions. So
That's great, Wendy.
That's probably about it, I think.
It's fantastic. That's absolutely fabulous. So I'm going to stop sharing here, and I have to kind of document these things and reiterate what I've heard today, because when we talk about measuring something, often we do it in numbers, and or amount of things that are happening. And I have to say, measuring CCI success, what we should be instead of, but we need to include this. And this is, we need to measure the strengths of relationships that we have. You just touched on that, Wendy.
Yeah.
We need to measure how perceptions have changed. Okay. What happened in the exchange? And what are our perceptions and our feelings that have changed because we've had CCI in place? We've had consumers and community in place as partners. And that the information that's being used can actually influence policy and create change at government level. We need to measure that as well, which is measuring that human experience and the stories and the richness of the stories that we can take from our communities to policy level to affect change.
Yep.
So
yes.
That's how we measure success.
That's exactly how we measure it.
That's fantastic. I'll just double check to see if we've got any more. I don't have any more questions in the Q&A. I will just go back to my slide deck because it's going to prompt me to, just hang on a second, to come in to remind me of what we're going to net. So the other thing I was going to say is that we will have another CCI webinar in 2025, and that will be based on the outcomes of our Women in Priority Populations project. We'll have a presentation about the outcomes of that. And indeed, all of these things that we've talked about, that Wendy's touched on, that Debbie's touched on, we've talked about relationship building, and that consumer voice is so powerful in affecting change. And Amy, was there anything else? I just thought, was there anything else beforehand? I can't get my slide. Oh, there we go. That's our upcoming webinar. That's right. This is sorry, my computer isn't changing the slides quick enough. You can view our WHRTN webinars online. There's a link there that you can click on to get our WHRTN webinars. And there's also an evaluation at the end of this webinar, and it's only about 2 to 3 minutes long. So I really, really encourage everybody who's participated today to fill that out. Not only to hear about your interests, but also it helps us do our job better. And so we can make some really good webinars for you for capacity building for all of our EMCRs, our early and mid-career researchers. So I wanted to thank you today for joining us. We're just a minute over time. And I'm hoping that this was informative. And I thank my speakers today, Wendy and Debbie and Jeanette. And thank you, Amy, for behind the scenes work. Your input today has been absolutely invaluable. So I bid you farewell and have a great rest of the day, everyone. Thanks so much.
Thank you, everyone.